Hey there, I'm your coverage buddy. Welcome back. If you're shopping for health insurance, you've probably seen two words pop up everywhere: HMO and PPO. What do they mean? Which one is better, and which one is right for you? In this video, I'll explain the key differences between HMOs and PPOs using simple terms and real-life examples. By the end, you'll feel confident knowing exactly what you're signing up for. Let's jump in. Let's start with the HMO, or Health Maintenance Organization. With an HMO, you're part of a local network of doctors and hospitals that have agreed to work with your insurance company. Here's how it works. You choose a primary care doctor, your main doctor. That doctor manages your care and gives you referrals if you need a specialist. You must stay in-network to get your care covered, except in emergencies. So, if you want to see a dermatologist, you need a referral from your primary doctor first. And that dermatologist must be in your plan's network. Think of it like a team. Everyone's connected, and you have a coach guiding your care. Now let's look at the PPO, or Preferred Provider Organization. This type of plan gives you more freedom. You don't need a referral to see a specialist, and you can even go outside the network, though it will cost more. Here's how PPOs work. You don't need a primary care doctor, but you can have one if you want. You can see specialists directly, no referral needed. You can go in or out of network. In-network is cheaper, but out-of-network is still covered, just at a lower rate. So if flexibility is important to you, a PPO might be a better fit. Okay, now that you know what HMO and PPO mean, let's break it down side by side. This is where you really see the key differences, not just in how they work, but in how they affect your everyday life. First up, referrals. In an HMO plan, you must get a referral from your primary care doctor before you can see a specialist. So let's say your knee's acting up and you want to see an orthopedic doctor. With an HMO, you'd first need to visit your regular doctor, who would then refer you. In a PPO, you can just schedule that specialist appointment directly, no middle step. Next, staying in network. HMO plans typically only cover care from in-network providers, which means doctors and hospitals that have agreed to the HMO's payment terms. If you go outside that network, your care usually isn't covered at all, except in emergencies. With a PPO, you get much more flexibility. You can see out-of-network doctors, and while it might cost more, it's still covered to some degree. This can be a huge relief if you travel often or want to keep seeing a favorite doctor who isn't in-network. Choosing your primary doctor. In HMOs, you're usually required to pick a primary care physician or PCP. This is your healthcare gatekeeper, the person who coordinates all your care and manages your health journey. In a PPO, totally optional. You can have one, but you're not tied to using them for referrals or management. It's up to you. Cost differences. Here's the trade-off. HMO plans are usually more affordable. You'll often have lower monthly premiums, smaller deductibles, and lower copays. But the price for that savings is less freedom. PPOs usually come with higher monthly premiums and bigger deductibles, but you get to make more of your own choices when it comes to your care. It's a balancing act. If you're okay following a structured system and staying in network, you could save a lot with an HMO. If you're someone who values options, freedom, and traveling across states, a PPO might be worth the extra cost. So, if you're a planner like staying organized and want to save money, HMO could be a smart move. If you want freedom and don't mind paying a little more to keep control of your care, then PPO might be your best fit. Next, let's look at some real-life situations to see how this plays out. Let's look at a few examples to help you decide. If you see multiple specialists regularly and want to choose your doctors, a PPO might work better. But if you're looking to keep costs low and don't mind working with a primary care doctor, an HMO could be perfect. HMOs can save money. Great if your kids have regular pediatric checkups and your family doesn't need many specialists. But if you travel often or need more provider choices, a PPO gives you flexibility. If you're healthy and only go to the doctor occasionally, an HMO might save you money. But if you want to manage your care without referrals and prefer having more doctor options, you may prefer a PPO, even if it costs a bit more. There's no one-size-fits-all answer. It depends on your health, your budget, and your preferences. Need lower cost and don't mind a referral system? Try an HMO. Want more freedom and doctor options? A PPO might be for you. When shopping for a plan, check if your doctors are in-network. Look at the deductible, copays, and out-of-pocket max. Don't just choose the cheapest plan, Choose what fits your life. Still have questions? Drop them in the comments. I reply personally. And if this helped you, give it a thumbs up and subscribe to your Coverage Buddy for more easy insurance tips. Up next, we'll break down deductibles, co-pays, and co-insurance, what they mean and how to budget for them. Until next time, stay covered and stay confident.